Hi, everyone. Welcome to the Collaborating Docs YouTube channel. I am Amanda Guarniere, a nurse practitioner myself and the director of growth here at Collaborating Docs. And I am taking over the YouTube channel today with a really fun interview. I am here today with Bevans Goodman, who is also a nurse practitioner and the chief brand officer at Array Skin Therapy. Thanks for joining me today, Bevans.
Thanks for having me.
I'm really excited to kind of dive into the topic at hand and kind of before we do, want to paint a picture for those tuning in. So here at Collaborating Docs, we match nurse practitioners and PAs with collaborating physicians. And many of our clients we work with have started their own practice, usually in primary care, aesthetics, telemedicine, IV therapy, and kind of other niche practices. Those are really the majority of the clients that we're serving. And I wanted to bring you on for an interview because I think that this particular niche that we are going to talk about is not well known among medical providers. So I thought that we could not only bring awareness to the specialty itself, but also talk about the potential business opportunity that it can afford advanced practice providers. So the specialty that we are talking about today is skin therapy or phototherapy. So Bevans, can you kick us off with kind of an introduction to this specialty and this particular therapy that we're talking about? And then we'll kind of dive into some other
Go
things
from
from
there.
there.
Absolutely. So narrowband UVB light therapy is a drug-free solution for chronic skin conditions. The top three that we see over and over are psoriasis, vitiligo, and eczema. It is sort of a tried and true treatment. It's been around since the 90s, but unfortunately, there's still a large lack of awareness about it. The the treatments that patients get given the most are, topical creams and sometimes biologics, things like that. Narrowband UVB is an option for a lot of people that they don't know exists. Um, so that's the treatment. Some dermatology offices have it and are huge proponents of it and love to see their patients improve on it. But a lot of dermatology offices don't have it. So that's kind of why we exist to meet the demand with our own niche individualized clinics that only offer this treatment. The other places where this treatment can be found are large university or medical centers. Um, those also have a problem with like parking being really inconvenient or difficulty getting into see the provider. The appointment has to be 2 or 3 times a week for it to be effective. And with these busy dermatology and university settings, those appointments can be really hard to get. So that's why we do this as a niche and a standalone service. So, like I said, it is a drug-free solution for many chronic skin conditions. Psoriasis, vitiligo, and eczema are the ones that we see the most commonly, but there is a whole host of conditions that it can treat. It's viruses, and there's even one type of cutaneous T-cell lymphoma that's treated with narrowband UVB. And just to give a quick overview of what it is, it's a very small portion of the natural sunlight that is called the narrow band. The narrow band has been studied for the last 30 years and is not associated with an increased risk for developing skin cancer. So it's a very safe type of light, and it has fewer side effects than topical steroids and biologics. So it's becoming a more popular solution for people struggling.
And so it's a drug-free solution. I'm assuming it's delivered via a device. Can you talk me through like what those devices look like? Is it something where your whole body goes in? Is it, like a handheld? Um, Explain to me what those options look like and what you might find inside, a dedicated skin therapy clinic.
Yeah. So we have three modalities of delivering the treatment. The first is a full body booth. It's head to toe, 360 degrees of the narrowband UVB light. That's for patients who have sort of widespread involvement. The second piece of equipment we have is a hand and a foot unit. So it's kind of like a desk, and you just put your hands in and you put your feet in, and and it delivers the light to those areas. And then the third piece of equipment we have is a laser. So the laser is our go-to for scalp psoriasis. It's super effective at treating scalp psoriasis. We treat the scalp, repart the hair, treat the scalp, repart the hair, treat the scalp, so that we can treat the entire scalp. And that's necessary because the booth cannot penetrate through hair follicles. So we have to use the laser to treat the scalp. So those are our three pieces of equipment, and we pick and choose what is the best plan of care based on how the patient presents in the clinic.
That is so interesting. And clinically speaking, is this something like what number of treatments is typical? Is it kind of a short burst of treatment and then someone is cured? Is there an ongoing maintenance? Like what's the frequency that a patient might need to use this therapy?
So for a flare, when the patient experiences the acute symptoms, treatment is 2 or 3 times a week, whatever they can fit into their schedule. Twice a week is effective. 3 times a week would get results faster. Once a week is not effective. So I tell my patients that if you're coming 2 to 3 times a week, I would expect to see improvement by 15 treatments. That's a visual improvement. For patients experiencing like itch and discomfort, they start to experience relief in those symptoms about 6 to 10 treatments. So often around 6 to 10 treatments, patients are saying they're more comfortable, they sleep better at night, they're less itchy. But for a visual improvement, I start to see that around 10 to 15 treatments.
Mm.
For a significant improvement, we usually see that around 30 treatments. So it's not a quick fix. It takes time, it takes consistency, but it is effective. Um, that is sort of the big picture, but like a better estimate can be given based on the patient's condition and, what area of the body is affected. Like for vitiligo, the face repigments much quicker than the hands and the feet do. So we tailor it to each patient, but I would say 15 to 30 to start seeing a significant visual improvement. Oh,
And
and then, sorry, go ahead.
no, I was just going to ask if it's safe for all skin types.
It is. It is safe for all skin types and for all ages, actually, and even pregnancy friendly, believe it or not.
Hmm.
So we do have a lot of women who, had to go off their biologic because of pregnancy, but are experiencing symptoms come in and get light therapy throughout their pregnancy and even breastfeeding.
That's awesome. You can't say that about a lot of the, medications. And are a lot of patients maybe doing a combination of both, light therapy plus topicals or other types of things, or is this usually kind of you pick one path or the other?
No, absolutely. A combination, I would say, is what most people come in with. We have a lot of patients who do use topicals at the same time. We also have a lot of patients that are like, these topicals aren't doing anything for me. I'm done. I'm over them. I'm not using them anymore. But I'm hesitant to go on like a bigger gun medicine, like a biologic or something like that. Um, so yes, absolutely, they can be used in conjunction. And even if a patient does need a biologic, this is a good treatment to sort of get them to the point where their biologic is working for them, because that
Mm.
can take a few weeks as well. And just to be completely honest with people, this doesn't work for everybody. It's not a cure. There is no cure for these chronic skin conditions, but it is an excellent treatment option. Um, some patients, have tried the topicals. They don't want to use them anymore because they're not working. They try light therapy, and we have to give it a good try, but sometimes they still need a biologic.
Mm.
Sometimes they can't get in for treatment because of their scheduling, or their condition is so severe that their quality of life would be much better off if they just used a biologic. So we have a whole variety of patients that we see, but that's the great thing, is that this can be a treatment for a lot of different things.
Yeah. And is it common for insurance to cover this?
So yes, insurance does cover. So most PPO insurance and Medicare actually also covers this. We would love to take HMOs, but we're unable to get contracted with them oftentimes. We always encourage people to try to get contracted with the HMO plans, but it's more difficult. But yes, PPO and Medicare typically cover this treatment.
Great, great. Um, I want to ask some questions about you. I know that you are a nurse practitioner also, and I know that, before working for kind of the brand side of the company, that you were working for them clinically as well. So I'd love for you to kind of walk me through what that looked like and kind of paint the picture of what a day-to-day might look like for a nurse practitioner working in a dedicated skin therapy center.
Yeah, so before I got sort of involved in the branding side of the company, I was a full-time NP in clinic. I still do 1 day a week in the clinics, which I love. But yes, for a while I was just clinic based, and I loved it. It's I always say I never want another NP job because this is sort of the dream job for an NP, meaning that you get to spend as much time as you want with your patients. So because we're so niche, um, our typical new patient consultation lasts an hour.
Wow.
So we truly get to hear the start to finish story. We hear everything that they've tried, what's worked, what hasn't worked, what makes it better, what factors make it worse. And you really build incredible relationships with your patients. So that is sort of my favorite part about the niche environment of light therapy. But outside of that, as an NP, you're seeing your new patients. Um, you know, Depends on the day how many new patients you have. I think the most new patients I've seen in 1 day is 4, so it's not like a ton. And then you are overseeing the treatment. So in the clinics, the treatment is delivered by a nurse, an RN. They're the ones who are asking the patients, did you have any side effects from your previous treatment? Any red, pink, or tenderness? And then delivering the next dose based on protocols that we have in place. So you're overseeing the care, but your time is spent more doing the new patient consultations and then completing follow-up visits, which we hold at least every 3 months to check in with the patient to make sure that their plan of care is working, that we don't want to change anything based on how their presentation has changed. And then you're also just answering questions because patients have a lot of questions, and it's a very, very supportive environment where there's always an NP available to ask. So we allow that.
That's awesome. So it sounds like not back-to-back 15-minute visits. You're not charting at night
No.
after your kids go to bed. Like it really sounds like the dream job. Where do we sign up?
Yes,
Basically.
yes, it really is. When I was first interviewing with Kristen, she was like, if you need a fast-paced environment, this is not for you. And I was like, perfect. I'm over
Say no
a
more.
fast-paced environment. Yes. Yes. And it's true. There is not it's not a back-to-back 20-minute patient cycle. Definitely not. It's more of like a supportive role, answering questions, doing a ton of education, and being the clinical manager of all the staff that are
Mhm.
delivering treatments.
Got it. So talk me through a little bit about, if a nurse practitioner uh, or a PA theoretically wanted to kind of work in this area or wanted to start their own um, light therapy clinic. I know that there's a business opportunity as a franchise owner through Array, and I definitely want to talk about that. And I'd also like to hear, like, let's say someone wanted to do it on their own. Like, can you paint the picture of the options that someone has if this sounds like something they're really interested in? Like, is there an opportunity to really build it on their own from scratch? What would that look like? And also, what does the opportunity look like to work with you all as a franchise owner, if that's what they want to look into more.
Yeah. So I have never built a light therapy clinic from scratch. I'll be completely honest. So I don't know exactly what that looks like. I know um, that it requires a lot of hard work and a lot of jumping through hoops and regulations, and you need a team to sort of walk you through, how do I do this? And that kind of brings me to why I think franchising is such a great model, because we give NPs the blueprint. NPAs, we'll come back to the NPPA thing in a minute, but we give franchise owners the blueprint on what to do. It is the path to success. We've been in business for over 10 years now, so we know exactly what it takes to make this clinic successful. And we give franchise owners the policies, the procedures. We give them marketing support, billing training, sort of soup to nuts, everything that they need, including a week of on-site training, and then ongoing support. Like, we're sort of like a call center for our franchise owners. Like, if there's any problems, we talk them through it. We're constantly connecting with them. So I don't know what it would take for someone to do it outside of a franchise model. Um, that's really the answer I have for you. I
Yeah.
don't know what that looks like, but I know that if the franchising model seems a lot easier.
Well, no, I agree with you because just kind of thinking as you're describing the setup, you obviously need a physical space. You obviously have equipment needs, which I imagine, if you're putting that all together yourself and kind of sourcing the different things that you need, it's going to be a lot of work. And also building your own protocols and, knowing kind of the regulations and what's needed and, building out the infrastructure of that type of practice. It's not as simple as, you know, starting a telehealth practice where you can, create an LLC, get an electronic record and start advertising, right? So,
Yeah.
but that said, it sounds like a really impactful and potentially profitable opportunity for someone who's attracted to this area of practice. Um, so I guess to take a step back, like if all I know about franchise um, establishments is like McDonald's,
Yeah.
maybe like explain to me like I'm five, the concept of a franchise. What does that mean?
Yeah. So franchising is a way of doing business where the business owner, called the franchisor, so in our case, that would be Array Skin Therapy, sell the rights to use their system of doing business, including the name, logo, policies, and procedures, and the operating manual to an individual or a group of individuals, which are called the franchise owners, for a contracted period of time. Then, when that contracted period of time is up, the franchise owners can either renew their contract or choose to walk away from the business model. As a franchise owner, you also get access to all the marketing expertise and advice, initial training, and ongoing support from the franchisor. So it's like when you have a business for yourself, but you're never in business by yourself.
So in this case, the franchise owner is exactly that. They are the owner and the operator of the practice. They're not employed or contracted by the franchisor. They are, essentially on
Yeah,
their own, but have the benefits of, I don't want to say
being a
business in a
part of a
box
system.
because I
Yeah,
feel like that oversimplifies it a bit, but essentially, they're getting all the benefits of here's how to duplicate this exact successful model
exactly.
with the ongoing help and guidance of the franchisor. Is that a
Yes, that's
fair
exactly right.
summary?
That's
Okay.
exactly right. I think who is a perfect candidate for and what we want is we are nurse practitioners, so we know that nurse practitioners have the skill set to be successful in business because we've done it. My partner, who is the CEO who founded this company over 10 years ago, is an NP, and she built this from scratch. So she's created 5 corporately owned locations in Southern California, and now we have 4 franchise locations that were 3 are up and running, 1 is opening next month. And we know it can be done. And the reason we want NPs to be our franchise owners is because not only do they have the skills that they need to be good business owners, but they have that essential element that a lot of business people lack, which is compassion. And compassion is so key in this niche because these patients are dealing with chronic skin conditions. They have emotional and physical issues that they're dealing with because of how they look and feel. That's certainly not all skin condition patients. Some patients embrace it as part of their unique identity, but the patients that come to us are having a very difficult time. So compassion is key. So that's why we want nurse practitioners. And because we want to empower them, we know what it's like out there for an NP, and we know that they can do this. So that is our goal, is to empower NPs, and then more importantly, not more importantly, equally importantly, is to expand access to this care because patients need it and they can't get it. They sometimes get put on a waiting list while they're flaring, or if they missed a week of treatment, they have to wait to see the dermatologist, which just kind of pushes things back in terms of when they can receive their treatments.
So another question I wanted to ask is, do you think that a nurse practitioner needs to have a background in dermatology or some sort of clinical expertise already in this field in order to be successful if this is an area that sounds really attractive to them?
The short answer is a confident no. Certainly that would be great and cool, but it's not required. None of the NPs that currently work for Array had a background in dermatology before we worked at Array. And now, we are the experts in light therapy. So you don't need that background because you're not diagnosing and treating, all of the dermatological conditions. We specialize in light therapy, so that is a very narrow group of conditions that we see. So it's not a requirement. What we do like is an NP who has been in practice for a few years, who knows how to talk to patients, who knows how to listen and be compassionate, and sort of has that experience and confidence of being a nurse practitioner. That makes a big difference. And I want to talk a little bit about PAs and RNs because they're not off the table. We certainly, if you're a PA or an RN and you're interested in this, definitely reach out to us. It's just a bit trickier because of healthcare regulations, right? So as an RN, you would also need to hire an NP, which, so they could prescribe the treatment. And obviously that would add to your upfront costs. Is it doable? Yes, absolutely. It is just a little bit trickier. Same with a PA. We're NPs, so we don't know exactly what the regulations are regarding a supervising physician and PAs. Could it be done? Yes, I know PAs who own their own businesses, but it's just not our bread and butter. But again, if that is you and you're interested, definitely contact us. We always require candidates to speak with a healthcare attorney so that they are well aware of what it takes to structure their company with regards to regulations.
Yes. Yes, that is a great point. From the collaborating docs side of things, we work with PAs who are frequently opening their own practice, but there are some states where the corporate practice of medicine doctrines are very strong, and there are some states that prohibit a PA from not being employed directly by a physician-owned entity. So again, I'm not an attorney either, but I'm with you that there are a few additional hurdles for PAs that's not the case for and Ps are not as frequently. Um, I want to touch, I'm sure that someone who's interested can meet with you and get a lot more detailed information, but just for someone who's still curious, I want to ask a little bit about the financial side of things. Like, what does someone need financially? Like, do I need to be sitting on a pile of, liquid assets in order to become a franchise owner? Like, just so that I know if I'm watching or listening, like, how do I know if I'm qualified to kind of do this venture? Because I'm sure it's not as much of a bootstrapping venture as someone who might be doing a telehealth practice, for example. I imagine that there's some sort of upfront capital needed.
Yeah, that's a great question. So the total cost to open is 318,000 to 389,000. So that's sort of what we tell people to have in mind as far as getting open, getting all your ducks in a row, ready to open your doors. We don't directly offer access to financing, but we can direct you to third-party lenders who can help secure the funds necessary to open the business. There are lots of opportunities for financing, especially for healthcare and women-owned businesses that we can set you up with. So that is sort of the upfront costs.
And should that number, this is maybe a loaded question, should that number scare someone away? Like that sounds like that's a large amount of money, right? Like most of us are not, don't have that in the bank or have access to that. Um, so, so many would be looking into financing. Um, but should that number scare someone, like just understanding what the potential business revenue upside is? Like, can you talk without giving specific numbers, of course, like, could you just talk a little bit about what that might look like so that, someone could know whether this is a potential worthwhile opportunity?
Yes, I obviously can't get into specifics, but what I can say is that we have 8 open and are opening more, and they're all successful. Um, so while I can't give a number as to that you can expect to make this much in this amount of time, I can tell you that we wouldn't have been in business for over 10 years if this was not a successful business model. Um, I would encourage anyone who wants to know the detailed numbers behind it to contact us. We have a very involved process of educating potential franchise owners on the numbers involved in opening an array, and that involves at least an hour up. Like one of the first calls you have is a hour meeting with our CFO who shows you all of our numbers. They show you exactly what it you would be investing in, where all the money of that 318 to 389 is going. And then we also show you the numbers that we've experienced in our growth and our revenue. So we can't say this is what you'd make because we don't know. It's a different market, different team, but we can say, in our experience, this is what we've made, and you can make your own conclusions based on what we tell on those numbers.
Perfect. I think, obviously this is the type of opportunity that if you're considering it, you're going to be thinking about it. You're going to have meetings, right? This isn't like a
Yes, not a
sign up.
fast process.
Right. So,
Right.
but that's good. It sounds like really the process is very supportive in someone exploring that option to see if it's going to be a good fit for them. So,
Fit.
if you're watching and listening and you're curious, it sounds like really the next best step would be to meet with your team, and have that kind of introductory call or whatever that process looks like. So for someone who might be interested, can you let them know what to do next?
Yeah, so you should go to arrayfranchise.com and read about us more, read about our story, get a better idea of what it is that we have built and what you would be a part of. if you're still interested, you would fill out the form on our website, and either myself or someone else from our team will call you. It'll be an initial like 15-minute call to see, where you're located, because that is important in our franchising. We're only expanding to certain areas right now because we know that those areas are the sort of the best for housing a niche clinic like this. So we would find out what you're doing, what your background, your history is, and where you're from. And then we would set up that first call where we would have Anne, who is our CFO, go over all the numbers with you. And I would also talk more about what it looks like to be a nurse practitioner or an NP, I'm sorry, or an RN or a PA or another ancillary healthcare staff as a day in the life of an array owner. So yeah, it's a very long call. We get all of your questions answered. We give you all the information that you need in order to consider this seriously. And then if you're still interested after that, then we have a call. Then you would have a call with our founder, Kristen, who's again also an NP, to talk about how do you even structure a company as a nurse practitioner, which she's an expert in. So yeah, it's a process. It is not like something we're trying to sell you quick. We need to make sure that you're the right match for us and that we're the right match for you.
Awesome. Well, I'll make sure all of that information is in the description below the video so that people can go click through. On the collaborating doc side, if you end up going through this process, like don't feel limited by if you're in a state that requires a collaborating physician, because that's certainly where we can help as part of this process, of course. And, Bevans and I have already spoken about, how we can help Array franchise owners on the collaborating physician side of things so that that's not a barrier for an NP who's interested in this. So Bevans, thank you so much for your time. I personally find this field fascinating. I think it's a wonderful business opportunity for NPs. So I hope some folks take some action and explore this opportunity after watching this video. And thanks so much for being with us.
Thanks, Amanda.